No worries. Hi, everyone. So let me just quickly share my screen just so I've got this set up. There we go. Can everyone see that okay? Yeah.
Yep.
Grand.
Yeah.
So this is quite a short presentation, just basically for today, kind of explaining about dentistry intensively from my point of view. So I'm coming to you live today from my work. I'm currently in work just now. I work in Motherwell in McMahon's Scott Dental Surgeries in Hollytown. So it's a general mixed NHS practice, and this is my first my VT job since I left uni. So I graduated last March, essentially, or last June, just after COVID started. We luckily managed to dodge having an extra year at uni, and we all kind of went through the normal process of getting jobs after leaving. So I'm in VT, or vocational training, just now, which I'll talk about later on what that is. So yeah, I'm going to quick run through it. You probably heard all this before about getting into uni, what I did to get into uni, what I thought uni was like, and dental school in general, and then a bit about what I do now as a natural dentist in practice. So just give a wee sort of round sort of overview of what I'm doing now. Please feel free to put stuff in the chat. I'm sure Martin that can let me know if I don't see any questions, if anything comes up during or afterwards, and we'll just have a wee chat. So I just thought I'd put in the BDS bit after my name because I can now, so it's quite nice to have that. So how did I get here? So I went to Holyrood Dentistry School in Glasgow. I did my English, maths, chemistry, biology. I did crash biology, which was a bit of a mistake. Far too much stress for anyone to deal with in fifth year. Music and physics, and also did advanced higher biology and chemistry, which I thought was really helpful to have. I know people will always get a bit, what should I take from my hires? And obviously you guys never sat your hires. But for going to advanced higher, that kind of stuff, I always thought that biology and chemistry, after having done dental school, it was a real help in first year, just getting used to all the sort of more advanced biochemical sort of stuff you need to know on your foundation years at dental school. I applied to Glasgow University for dentistry and also anatomy. They always sort of recommend use all your UCAS choices. Slightly get 5 now. And you'll have all the dentistry ones. If you're going to do dentistry, have one backup. So I chose anatomy. And those life science type courses at Glasgow and most universities, if they read in your personal statement you want to do dentistry or medicine or whatever, they often just accept you. So I got into anatomy really quickly, which I thought, oh my gosh, that's me, I'm off. But so you want to keep it of your dentistry. So Dundee, Glasgow, Manchester, and Newcastle. And I got into Glasgow, Dundee, and Manchester, and I got a knockback from Newcastle. Never found out why, but didn't really matter in the end. So I accepted my Glasgow offer and did my BDS, which has a Bachelor's of Dental Surgery, from 2015 to 2020. And I was meant to finish in June, but I finished in March, so that was that. And now I'm doing my vocational training, which is run by NES, which is a special health board in Scotland called NHS Education for Scotland. And I'm doing that in general practice at McMahon's and Scott Dental Surgeries. And I've been here since September, and I'll be here till next July. So usually vocational training lasts about a year. It's kind of equivalent to like FY1 for doctors. It's your foundation training. It's your learning to drive the car after you pass your test type thing. And you're mentored by a dentist in the practice you work in, and you do a lot of work towards getting what's called satisfactory completion. But again, I'll go over that later on through the talk. So applying to uni, what I did again, so I think right now it's still 4 years in a B or 2 years and 2 Bs at S5, sitting anyways to get into Glasgow University for dentistry, and it's roughly the same for most Scottish universities down south. I think it can be a bit higher, just depending on how they rate hires and advanced hires to their A levels. Personal statement, I was talking to Martin earlier on about you've done your personal statement workshops, which is really important, and that is basically your here I am, this is me type project to work on over this summer, so that you have that ready for starting uni. So it's not due till October, but I would recommend doing it now. So over my summer and fifth year, I spent most of my time writing and rewriting my personal statement. I think I did about 7 or 8 drafts before I had a finalist draft. I needed that, handed it into my pastoral care teacher, and they were like, no, do it again. So it's a case of doing it again, get lots and lots of feedback from your peers, from teachers, from family and friends, and just get them to read it loads. Is it make it concise, to the point, talk about dentistry loads, even if you're applying for things that aren't dental related, talk about dentistry and what a lot of the qualities you need to be a dentist sort of apply to a lot of different things as well. So if you're wanting to do dentistry, fire in with the I want to be a dentist message through all the stuff. also include things about volunteering. Your work experience is really important. And also if you've done a work experience, obviously dental work experience this year has been virtually impossible to get. But should you get any work experience, that could be a GP practice, medical GP practice, or in a hospital, again, unlikely, but again, think outside the box. All these things will still give you lots of grounding to help talk about work experience in a healthcare setting. Doesn't all have to be dentistry, but obviously dental work experience is the preferred choice. And all your extracurricular stuff. So things you do out of what school or work, whatever you do to make you a nice, well-rounded person. Dentistry is really difficult. I need to have a really nice, well-rounded personality, well-rounded skill set to be a good dental student and an eventual dentist. So show that you have that from the outset, and talk about why, when you play five-a-sides, it makes you a good team player, and it could, it makes you committed to a sport, or why, if you play the violin, how that helps your violin dexterity, and you work as a team with the rest of your string quartet or your orchestra, whatever. Just try and elaborate and really expand on all the ideas you have, and think about how they all apply to being a dentist or dental student. UCAT, obviously, no one likes UCAT, and I can't sugarcoat it any other way. It's horrible, but it's one of those extra steps you need to get over to allow the university to sort of weed out people. And all you can really do is practice, get a strategy so that when it comes to an exam, how you're going to approach it. And it's not something you can really study for. It's one of those things. It's just a case of, someone's come in for wait a minute. It's a case of just practicing and getting yourself ready for that test. Then your interview, which comes obviously later on after you've applied and that kind of stuff. Glasgow run an MMI, which is a multi-minute interview. And I think you'll get probably some reach workshops later on in the year about those. They are a really great form of interviewing process. It allows you to have 7 or 8 individual, non-biased, judgmental interviews for something. So with a regular panel interview, if you were to mess up in a question or say something you shouldn't have said, then not that they would, but sometimes you might find that the interviewers would then maybe have a bit of, well, they said that a wrong question there, etc., etc. But if MMIs, it's 7 different interviewers, 7 different stations, 7 different sort of scenarios. So you have a really good, well-rounded, non-biased view of your candidates that you're doing MMIs. So personally, I enjoyed them the most. I did a couple for my interviews in Dundee and at Glasgow. I think they're really good. So Glasgow do that as well. So it's a really good way of interviewing, and it's quite stress-free, if you can say it's stress-free at all. Okay, so dental school, so much fun. It was the best time ever. So 5 years flew by like that. They always say that, you'll be done in 5 years, and that'll be the quickest 5 years of your life. It actually is the quickest 5 years of your life. You're often quite a small year group. At Glasgow, you're based up at Hill Street, so you're away from the main campus. It's just dental students you see every day. Plenty of social activities, really interesting, diverse course. You do learn a lot of other things apart from dentistry. I think that's one thing I didn't really appreciate when I was at dental school or applying for dental school, that how much you need to know to be a dentist, and how much things out with the mouth are really pertinent to oral health and dental surgery. So you learn way, way more than you think you're going to learn, and it becomes a bit, oh my gosh, there's so much to learn here. But that's what makes it so interesting. It's not just teeth, because like anything, if you do something for long enough, it will be a bit, right, okay, we've done this, we've done teeth for enough now. So you get lots of stuff to learn in dental school, and lots of different opportunities as well. Lots of opportunities to study different things. I went to a lot of conferences at uni. I went down to London to go to a GDC conference. So the GDC are the governing body of dentists in the UK. And that was a really exciting experience too, to be able to go and do that and represent my university and dental students as a whole down there. So lots of opportunities to do lots of different things and develop your skills out with dentistry and that kind of stuff too. The outline of the course, you've probably heard this already as well. Year 1 is just basics, all your basics, like basic biochemistry, your basic anatomy, your basic dental anatomy, lots of your health sciences. You cover a lot of immunology, a lot of physiology, all your sort of bodily functions, that kind of stuff, on a very basic level. So the first year, I don't really feel like you've done much dentistry because you've learned so much, but that is all going to get built upon as you go on. In second year, you do what's called optic or operative techniques. That's where you actually learn how to use a drill and that kind of stuff. So that's really exciting until you work out you can't use it very well, and you're all fingers and thumbs, and then you get more stressed. But you build on that again, and building on all your year 1 knowledge and that kind of stuff. And at the end of year 2, you start to see some of your own patients, and then in third year you see your first patient on your own, and that's a very, very scary day, but it's a really good day because you finally sort of got to do what you want to do. In third year, you do a lot of head and neck anatomy, so you go into the anatomy labs and you get a cadaver and you do a lot of in-depth learning about the head and neck, and that kind of stuff, and also things like orthodontics, pediatrics, oral surgery, all the sort of fancy stuff, all the specialties of dentistry. You've been dying to try, and you eventually get to go and do it. And year 4 is your final, so that's all your final written exams, and you learn everything under the sun. You need to know everything for your final exams, and it's a chaotic year, but again, filled with so much fun stuff and so much to learn. And in 5th year, your other finals, your OSCEs, so your big final practical exams, you go to outreach. So I was based up in Kilmarnock for my outreach. So it's basically you go to some sort of like a health centre, and they have a dental surgery in the health centre in which you see your own patients with the help of some tutors, almost like what I'm doing in work just now, but it's through uni, and that's where you hone a lot of your skills you've been practicing over the last couple of years. You also do consultant clinics, you go to hospitals, you go do placements, and you start job hunting, which is another thing I'll go into, and then you graduate. So my graduation was actually yesterday, on Wednesday just there. I graduated on Zoom last year, but I finally got my graduation photos on Wednesday, along with a lot of other students who were graduating as well. So it was really fun to do that too. So 5th year is a whirlwind of things, and it's even more sort of crazy last year with COVID happening. So right now, the 5th years, there's 2 sets of 5th years essentially just now that I've had to repeat the year because of that. So yeah, that's a bit interesting as well, isn't it? So it's a few pictures just to, so that's my first day ever. So basically we're practicing how to sit and get the patient in the chair, and how to sit and what to wear and how to put on your PPE. And you can see I look absolutely terrified. So that was really fun that day. It was my friend Suzanne there. So that was a really fun day doing all that. This is a halfway ball, so you get a lot of, again, social events. So there's a 3rd year ball, so you get a halfway and a final ball. We didn't get our graduation ball because of COVID, but we did get our halfway one in 3rd year, and that was all us celebrating halfway to being dentists. So that's really fun as well. That would be in my outreach placement in Kilmarnock. So you're 5 people usually, or 4 in this case. And I was in my wee surgery there. Actually, it's quite a big surgery compared to where I am now. But yeah, that was a great time. That was the end of my placement there in February last year. So that was just before COVID happened, which is crazy to think. So yeah, seen lots of patients there, really, really supportive teams. You do lots of stuff on your own. You start to really think like a dentist and like a general practitioner dentist too, which is really important because that's what you're going to be, probably most of us will be anyways. That was our panto, so we do a pantomime every year. The 5th years do a panto for charity, and we did Beauty and the Teeth. So it's always a dental pun, which is quite sad, but it raises lots of money for charity. And there's me just in I did all the music stuff for in the panto, so all the sort of band stuff and getting everything ready. So it was really, really good fun, and we raised about £2,000 for different charities. So it's nice we highlight to a year, 5th year, because you do lots of things together to try and sort of enjoy your last year together, because everyone splits up after 5th year. So it's good to have a little bit of fun there as well. And that was us, our graduation pictures, or that was our last final year picture. It was taken in like December of 2019. So missed them all. It's quite I've not seen a lot of people in a long time, so it's good to see everyone again. Okay, and that was me. Oops. And my graduation on Wednesday, so just thought I'd put that in there as well. So VT is where I'm just now. So vocational training is the equivalent of first year, sort of foundation year 1 for medics, and it's where you learn a lot. Again, it's kind of almost like people say you learn to drive once you've actually passed your test. It's kind of like you've got your degree, so now you have to start learning how to be a dentist. So you basically work in general practice, and you apply nationally throughout Scotland for places and different practices that are trained to support new dentists. And you can either have 1 trainer or 2. I have 2 at my practice, which is really fortunate, and lots of associates to help as well. So you see your own patients, you have your own nurse, you make all your own choices, but you have that person to go to, your trainer to go to ask for advice, or if you're struggling with a procedure that you can't get a tooth out, or you can't find a canal to do a root canal, that kind of stuff, that if you didn't have someone there, you get kind of stuck on your own. So it's a very steep learning curve, because you think you know a lot of stuff when you leave uni, and then you find out you don't know anything really. Not you do know stuff, but you're very lacking in experience and be able to make good clinical judgments and clinical choices. So you learn lots from your nurse and also from your colleagues at work as well. Right now I'm working about a 4-day week just now, so a Wednesday I have off to go do other things. Recently I've been doing a lot of vaccinations for Glasgow Health Board and Lanarkshire, so that's been nice to be able to do that as well, and have a different kind of working week and been doing that, so that's really fun as well. So usually it's 1 year of general practice with your mentor, but this year it's been 2, just because of how slow the year's been. Dentistry has been really heavily affected by COVID, purely because a lot of the work we do involves aerosols, and that then generates transmission for COVID type things. So that's been that as well. So it's a bit slower. So 1 more year in practice, which is really nice. In Scotland, it's called VT, so that's for Scotland only. But down south, it's called DFT, or Dental Foundation Training, and that's in England, Wales, Northern Ireland. So you can apply to either or. I applied to both, just so I had both options open to me for when I wanted to get a job. I got a job down in Northumberland when I was applying for DFT, and I got a job here in Motherwell when I was applying for VT. So I always wanted to stay in Scotland, but there's always a chance you might not get a job through one of the schemes. So it's good to apply for both, and that just means you've got extra experience and more choices for where you want to go. It's a very interesting recruitment process. So applying for VT, you essentially usually go to do face-to-face interviews with your practices you want to go and visit, but obviously last year it was always via Zoom, so I had loads to do, lots of Zooms, interviews, that kind of stuff, and little sort of practice tests and be sort of interview type things with different dentists. And then you pick 7 people that you want to work with. So you pick 7 practices you want to apply to. The trainers, the people who own the practices, they then pick 7 candidates, 7 dentists they want to hire. And then some wizardry in the NHS matches you up so that, like if you put John Smith as number 1, then if John Smith put you as number 1, then you get a job together, and it matches you up. So it means that no one matches with someone who didn't want them. So I didn't want to work there and they didn't want to work with me, we wouldn't ever get a job together. So it works quite well, and most people find that they get a good match based on that. So it's all worked well for me, thank goodness. But yeah, it's quite a weird process to go through, but that's quite a long way for everyone obviously here today. Again, you're fully registered. So with FY1 medics, the first year medics, they're not registered with the GMC until they've done their first year, whereas dentists, you're fully qualified, so you can do whatever you want. But obviously you do lack in experience, so that's why you're placed into foundation training, just to kind of get you up to speed and get a bit more safe and a bit more confident with your diagnosing skills and your technical abilities, that kind of stuff. So you have lots of autonomy, you have lots of choice. There's no one that makes. I make my own choices with my patients. I don't have to ask my boss, can I do this, can I do that? I might ask them, should I, or what do you think, and show them x-rays and show them, see the patients, that kind of stuff. But it's ultimately a lot of my choices I make myself. They come in sometimes to examine me, so I'll be doing a procedure and they might come in to watch me and then give me some feedback, and that goes back to the health board to sort of check off that I've done so many of these exams after every couple of months to just check on my progress and make sure that I'm making good progress and that I'm going in the right direction. And where to go after this? So I've got another year here, which I'm happy about. But where do you go after you've done VT? So you become an associate. So associates are like dentists who work in a general practice, see their own patients, have their own lists. They work essentially on their own, but within a team of a lot of dentists as well. You could buy a practice and become a practice owner, which is a lot of work to undertake, but it means you own a practice, you can hire staff, you can choose what the building looks like, who you want to hire, what you buy in for materials and equipment, and you can make it your own. So there's a lot to be gained from being a practice owner, in the sense you can make a lot of the choices that if you're an associate, you can't, because you don't own the practice. There's also CT, so core training, so that's almost like FY2, where you can go and do some further training within the NHS and different specialties of dentistry, so pediatrics, orthodontics, oral surgery, head and neck surgery, restorative dentistry, all these kind of things that are more specialised, and you can go and be someone essentially my grade and 1 year above, and work in those clinics and those places with consultants and registrars, and gain more experience, and then either choose to go back to uni to do further training and studying, or apply for a post as a registrar. So registrar is the next step up from core trainees. That's you're on the path to becoming like a consultant in a specialty of dentistry. Or you can go traveling, so you can go and work abroad or work somewhere else. Recently, just found out that some cruise lines, this is really weird, some cruise lines hire dentists on board as well as doctors and nurses, so you could potentially be away for 6 months in the Caribbean, who knows. It's a bit of a weird way to work. You probably wouldn't do much of normal dentistry there, but it's an option to you. So a few months ago, there was an advert in one of the dental journals for a dental officer, so a dentist who works for the government, to go and do a 2-year sort of secondment to a wee island in the Caribbean or the Bahamas somewhere to work and try and get a feel for the population's dental health and try and help them plan their dental workforce they might require for the future for their population. because we don't really have a lot of permanent dentists and this island requires a lot of sort of international medical aid from different places. So there's so much you can do with dentistry, but also working as a GP practitioner is also a lot of work in itself. So I'm looking forward to see what's happening. My plan is to hopefully go into core training. I quite like the idea of going into doing more hospital-based dentistry, doing oral surgery or something like that. I'm not the most interested in cosmetic stuff or a lot of restorative dentistry, but again, I'll do some training hopefully and see what I like, and I might change my mind and come back to practice, who knows. So that's kind of what the outlook is like. Just some pictures, obviously that's when I first started to look a bit less tired than do today after a long Friday. And my wee surgery is just off to the right there, and that's where I am just now. So it's a nice wee surgery here. It's big enough to accommodate me and my nurse, and be comfortable enough, and nice big window in the back for plenty of ventilation for COVID stuff. And yeah, it's a really good practice. So it's a nice place to work. It's my normal setup on a Monday morning for like a root canal treatment. So I think it's getting used to knowing all different things you work with. At uni, you work with different machines and different procedures and different materials. So it's important to know what you do in practice. And it's taken me quite a few months to get comfortable with my new way of working and knowing what the practice uses and what my nurse recommends I use and what previous VTs and previous dentists that they've worked with have used in the past. So it's constant learning and getting used to stuff like that way as well. A few gory pictures here. I tooth took it the other day, so I had to section a tooth. So I was taking a tooth out and I had to cut it into a few bits. So that's a good picture there of a badly broken tooth. And unfortunately, that's a lot of what we see just now because in COVID, there wasn't appointments to go see your dentist for things that we could have been fixed later on. So we're seeing quite a big decline in people's teeth and having to do a lot more drastic things like taking out teeth or doing root canals because decay and other things that have went unchecked for the last year have gotten a bit worse. So every day is a bit of a struggle sometimes getting things like that through to patients, but it's all part of the learning curve as well. Taking x-rays, so it's a few x-rays that I thought were quite interesting. This is a wee girl who came to see me a few months ago, and it's only 6. So at 6 years old, we expect to see the big permanent molars coming through. You can see at the very back here, and also the permanent front teeth that are coming through as well. This wee tooth in the middle, so you can see my wee cursor there, is a wee baby molar tooth, which should be there until she's about 12. This big molar tooth here has pushed that right out of the way and basically destroyed all the roots beneath it. So I'd send her off for a wee referral to the orthodontist to have a think about how we're going to fix that problem. If that tooth then keep moving forward, the tooth that's going to come in through here when she's about 11 won't have any room to come through. So things like that, things I've never seen before, but are very commonplace usually for more experienced dentists. For me, it was like, oh my gosh, this must be like, seems really exciting, must be really rare. But again, talking to my trainers, they're like, this is quite common, and this is what to do with it. So it's just about learning common things that happen, because as I always told at uni, common things occur commonly. So it's about recognizing common traits and common things that happen and being comfortable dealing with them. That's the whole idea about being in practice and being in DT, is learning about those things. Here's another example of some broken down teeth that I took out a few weeks ago. Again, just it's a shame when we came in with a lot of pain. You can see here there's a lot of broken teeth. You can see that sort of very sort of dark line in the middle of the teeth that's in there with the tooth. And you can see this decay extends right into there. She's also got some infection around the bottom of these teeth here. And she's going for an operation, a gastric operation. So for me, these are big infection risks. Obviously, if you're going for a big operation on your abdomen or anywhere, especially your heart and things like that as well, you want to make sure you're dentally fit. Your mouth is a really sort of open environment for bacteria to get in and cause problems. And if you have dental infections and then you go for a big operation that you're maybe in intensive care, or you have a lot of problems like that, then the last thing you want to have is some sort of dental infection, possibly causing you a lot more grief than it needs to. So again, it's about having more knowledge about just teeth and be able to understand the whole body context and how the mouth and dental problems can relate to that as well. I took it out a few weeks ago as well, when I be listening to it, and you can see here how funky all the roots are in this one here. I was lucky this one came out in one piece, so that was another crazy Friday afternoon taking out teeth. So hopefully today is not the same. That's fine. A wee crown fitted, so this woman came in pain around about Christmas time. This tooth here had a root canal started, and then we had to redo the root canal, and I wanted to do a little crown on that tooth there to help protect it long term for any fractures and to help restore it, because it was quite worn down as well. So she's now had quite a few months of that being good, and hopefully plenty of years with that tooth not giving any more problems. So that was one of the first ones that I had ever done in DT, doing crowns and root canals all in one go, and be able to sort of be like, that's my work done, and took some photos of it too. So that's nice as well. And then, quite sadly, obviously, this person came out to see me a few days ago, actually, with a lot of white patches around his gums here. You can see a lot of the gums coming away, and it's a very big ulcer over here. And this is like a Tuesday morning. The man smokes about 4 or 5 cigars a day, has done for 20 years. He also had a big massive lump under his neck here as well, a very firm lump. So this is one that we thought possibly might be a case of oral cancer. So it's, again, something you don't see very often, which is nice, but oral cancer generally, it's on the rise. So it just sort of highlights the importance of our role in preventing very, very serious disease, and being able to understand the mouth and know what's going on, and a gateway for patients to come and see us and seek a further referral. So this man here got put on an urgent referral for suspected cancer, and he'll be seen within the next 2 weeks of that initial referral by the head and neck surgeons over at Monklands Hospital in Motherwell. So hopefully, fingers crossed, it's not anything too serious, but if it is, it's important they get seen quickly so that they can get his diagnosis and his treatment plan sorted out, which might involve quite a lot of surgery if it is that case, of possibly some chemo radiotherapy. So we hope it's not that and it's something else, but just to highlight that kind of thing as well. And it's been my nurse Denny. It's us on a Friday afternoon in our gowns, our new PPE. So PPE is become a big thing over COVID. So now we're having to wear big respirator masks. I've got mine over here, which are actually quite comfortable. I wear loops as well. So loops are these glasses with binoculars on them and help to sort of bridge your nose to the thick nose pads and those masks. And we wear full-length gowns now that you'd see in operating theatres, and gloves over the cuffs. And at one point we were also wearing like surgical caps over our hair to keep the aerosol out of our hair, and also visors as well. We still wear visors too. I wear the loops, so I don't have to wear a visor that often. But Denny wears a visor as well. And after every patient, you have to clean the surgery down with bleach and chlorine solutions, all the walls, the floors, the chair, everything as well. And also leave the room to fallow for 10 minutes. We've now got our fan. You can just see that over there, that fan. Oh, I can do that up there, which helps to extract the air. And like I said before, a lot of things in dentistry create aerosol. So it's when water and air get mixed together and make a fine mist. So obviously if you're drilling in someone's mouth and you're obviously involving some saliva in that aerosol, that's a very potent way for COVID to spread. And that's why we have to take all these extra precautions, and why everything's a bit slower just now with dentistry. So that's really a wee overview of that. So, but we're so used to it now, we're kind of just normal. It feels like normal now doing it, so it's not too bad. So like I said, what's next? So I'm still here till July 2022, maybe do core training. I'm thinking maybe going to work in the community service. We do a little bit of head and neck surgery, possibly some pediatrics, don't know. I'm also doing my MSDS just now, which is the membership of the Faculty of Dental Surgery with the Royal College of Surgeons. So it's a postgraduate diploma you get after you finish uni, and it's basically just a reinforcement of your current knowledge after university. So it's all about your technical skills, your communication skills, your clinical knowledge, and it's a 2-part exam you sit, and if you pass that, you're then a member of the Royal College of Surgeons for dental surgery, and you get your MFDS after your name as well. So it's good to have on your CV. It gets you extra points when you're applying for these core training programs. If you've done that, a bit extra study, a bit extra work. So yeah, that's really me. So that wasn't too bad. Maybe half an hour, 45-minute talk there. Good to take any questions. If you want to ask any questions, just fire in.
Thanks, Ryan. That was great.
No worries.
I'm fine apart from the pictures of like.
I know. I probably should have said there's a bit of a warning there, but do you know what? It's dental surgery. You have to just skip them the facts. Is it?
Totally. So yeah, everybody, as Ryan said, just as normal, just feel free to fire your questions into the chat box. I was good about the cruise as well. That sounds.
I know. I never thought either, because I was on a cruise and a few years ago, and I didn't have toothache, but I was kind of thinking, I wonder if I had, like, what would I do? Because obviously the doctor on the board, but I mean, probably I'd just get shipped off at port to a dentist. But I was like, if it's a job going on a cruise ship to the Bahamas, I'll gladly go. I'll be there. So it'd be cool. So Marian's asking, who are the best people to show your personal statement to before sending it? So I showed mine to my parents, to my friends, especially if you've got people who are also applying for dentistry. Just read theirs, and you can critique each other's style of personal statement to see what they think of yours and what you think of theirs. I gave mine to my pastoral care teacher at school. Obviously, they're not going to know exactly what people are looking for within admissions, but they might have had people who've applied for dentistry in the past, and they might, if they got in, then they can give you some pointers. Similarly, if you want to fire towards me, you could send it through Martin. I think Martin will send it to me, and I could give you some feedback if you want. Again, I don't really know.
We're also
I'm not on the
running.
admissions board. Oh yeah.
Sorry, Ryan. We're running like a personal statement check-in sort of service, I suppose you could call it, towards, when would that be? It'll be towards the end of mid to late September, so that you've got it back in time for, the mid-October application deadline. So yeah, there's that as well.
Yeah, so I don't mind if anyone wants to send to me especially, or to Sophie as well, then fire them in. I don't mind reading them, giving them some honest feedback, but again, I can't guarantee that my feedback will be of any use compared to the guys from Reach. So I'd probably send it to them as well. What posed the biggest challenge to you studying dentistry from you? Biggest challenge, I think as dentists and people who do dentistry are very self-critical, and I'm still the same way. It's good to be self-critical because obviously you'll never get better unless you find issues with what you're doing, and so you learn to be quite sort of regimental of what you're doing and quite analytical of all your work. I think just having confidence to do stuff and to take risks with patients, and be a bit direct, like what you're talking about. Even now, people still look at me and go, "Oh, you're a bit young, aren't you, to be telling me about my teeth and that kind of stuff?" And you have to just be like, "Listen, I'm the person that you come to for help, so you need to just listen to what I'm saying and listen to the options I'm giving you, and then you can make your own choice." And then also having the confidence to deal with different consultants who are, on the whole, very knowledgeable, but very scary people because they're consultants. They've got quite a lot of esteem, so being able to take a lashing from them and being able to just be like, "Oh, whatever, it's fine." Having a thick skin, that's probably what I'd say is the biggest challenge. I'm quite delicate, I think, sometimes. So I think being a bit more tough and just confidence and just not giving in, that's it. I say that's a big uphill struggle. It was really enjoyable, of course, and so is the job, but you do have to have a bit of a thick skin to deal with your own self-doubt and self-confidence, but also people you treat and folk you work with. That's the case in a lot of jobs, a lot of professions too. What year was the most chill? I think fifth year I enjoyed the most because it's just all clinic. You're just doing patients, and you're just learning loads. And there was also so much other stuff going on, like at the time, potential graduation and grad ball and that kind of stuff. But I enjoyed fifth year the most. I think most people do. I think third or fourth year was probably the most stressful because there's so much to learn and get done. Second and first year are just a lot of learning, so it's just a bit tiring because you're just constantly learning stuff and lots of things to memorize and to understand and get concepts around your head, and lots of exams as well. But no, I think fifth year was the most enjoyable. I don't think I could say anyone was chill, but the fifth year was an enjoyable one. Biggest difference in being a dental student and being an actual dentist in the world. I think, like I said, your autonomy. So in dental school, you can say, "I want to do a filling in this, I want to do a crown and a denture, and I want to send them off for this referral to that." And your consultant will go, "No, you're going to do this, because this is what works, and this is what will be good for you to do." Whereas being a dentist now, all that is on you to decide. And I always ask people, "What you think of this, and look at this X-ray for me, and what do you think of this, and should I do that or this, and what would you do?" So in the same way, you're still making your own choice, but you're having to ask folk for their opinion, which is good. So that means patients quite like it because they know that you're looking after them, you're trying to just get the best for them, and you'll get some advice. But I think it's that the big difference is being able to make your own choices and being responsible for your own choices. So having to deal with when things go wrong. I remember being told as well that at uni that I could do XYZ, but I don't know how to fix XYZ. So that's when you know you're getting somewhere. If you can fix your own problems or fix things that went wrong, that is when you're getting somewhere, because a lot of dentistry is fixing things that went wrong and trying to prevent things going wrong in the first place. So that's really a lot of work we do in dental surgery. So I think that's probably one of the big things I find are different. So Taylor said, "How are you finding ET? How is it different, or how does it feel in the dental hospital? That's fine, not sure if you know that was on. All right, hello Taylor, hello, how are you?" So DT has been good. It's been fun. It's just different from dental school. Dental school, it's lots of faff, isn't it? It's just like need an X-ray down to the third floor, back up to sixth floor again. Right, need to get tooth out, back to third floor, back up. You're lots of. It's not. It seems quite complicated. Whereas now, someone comes in and they've got toothache, the tooth's not fixable, I can take it out right there and then. I can give them some local anaesthetic without having to ask, someone, can I give them this drag? You just have a good understanding of how to do things safely, and you don't have to worry about asking for help. Like I said, oh, someone's coming. And that's the big difference. I think it's just being a bit more self-guided. You can just do things on your own. It feels a little less faffy, but at the same time, it's quite. It's not lonely, or like you don't feel on your own, but you feel very much like I am coordinating this now. This is my. You feel a lot of responsibility. That's what I'm trying to say, I think. And you go home, like I've had lots of nights at home thinking, oh gosh, hope they're okay. Like I hope that's worked okay. And then you come in the next day and you find some section notes, like has anyone been in? I always do it a Thursday when I'm off on a Wednesday. I come in Thursday, and the first thing I do, I turn the computer on, is check Wednesday book and see who's been in, any of my folk been in, what's happened, what do I need to like think about, do I need to phone someone? So you end up being quite attached to all your patients. And I think at dental school you weren't as much because you had so little contact with them, and you also weren't doing that much at a time, and never really saw a lot of toothaches, a lot of things that were kind of, oh, I hope they're going to be okay going forward. So it wasn't too bad. Plus, you're obviously working with a consultant or with a dentist who kind of took the reins with regards to the treatment plan and the final result of what you're doing, and fix things that kind of went wrong. So you're a bit more in control of that now. So that's what I'd say is the big difference from dental school to here. But it's all part of it's much more enjoyable, I think. And it's good to be out. I'm happy that I'm out doing it and I'm not still at uni, because I think we all thought we were going to still be at uni for another year, which would have been fine. I think I would have enjoyed it, but I think you learn more by being in practice and doing it for yourself too. Why did you choose to take 6 hires instead of 5? So I was doing 6 hires. That's scenario. I was doing 6 hires, and I quickly realised that's not the right thing to do. That's not healthy. That's a lot of work. So I started off by doing maths, English, chemistry, physics, and music. And then this was obviously like a few years ago now, and I think I must have maybe misread what's going on, but I thought I had to have higher human biology sat in 5th year for Glasgow and Dundee. I'm sure when I contacted them and said that was the case, that might have changed. Just check that with someone else, I'm not sure. So I was like, oh, okay. And I had to go to my year head, like, please get me anywhere into biology. Like, I'll do it in my own time, anything. So eventually I had that. I was doing biology in my own time, and I was like, this isn't working. So there was a space to move into like, move blocks. So I eventually went into like a crash higher biology class, and then I was in a different chemistry class and dropped physics and did that in 6th year. So I only did 5 subjects in 5th year. That looks kind of different on the PowerPoint, but yeah, 5 hires in 5th year, and then advanced higher chemistry, biology, and higher physics in 6th year. But I did crash higher biology in 5th year, which was fine. Just need to work harder to get there. But yeah, that was my fault for doing a bit of a funny way. But no, I only did 5. Was dental school what you expected it to be before you got in dental you didn't expect? If so, how did you overcome this? I didn't really know what it would be like, full stop. I think I went into dentistry just kind of hoping I'd like it, which is not a good option either. And then kind of like, no, I do like it. And I'm kind of good at it, so I'll just keep going with it. I also told you that I did do medicine, but then I think I'm not that great with like feet and like that stuff. So I was like, nah, other end of the body, I'll just deal with that. And so it was what I expected in the sense that it was a lot of work, but I think I was pleasantly surprised by how much diversity was in the course, how much like medical and life science knowledge was in it too, because it gives you a really good grounding for going forward. The good thing about it is very, very little academic writing, which is what I was really dreading, because I hate writing essays, I hate papers, I hate all that kind of stuff, which is something you need to get good at kind of, but there's very little of that in dental school, which is good. There's no dissertation, that kind of stuff too. So it's kind of different from normal honours courses where you have to write a dissertation, that kind of stuff, a 5 years bachelor's. So it's kind of a bit of a regular degree anyway, same with medicine. But yeah, so I was pleasantly surprised, and it was what I thought. And I don't think there's much to overcome. I just had to keep working. It's just lots of hard work and, like I said, perseverance and self-belief. Just I'm going to get there, and to just look towards the end, and then you get there. So, and there's lots of support. You get your own advisor in dental school, your own mentoring group. So you get lots of support, and they're very encouraging of self-reflection and keeping on top of your stress and regular check-ins, that kind of stuff, because it's a very different degree. Medical students, nursing students, they're on placement all the time, and they have to be in hospitals doing night shifts, whatever. But we're the only sort of degree profession that you need to actually manage your own patients, and you're essentially working you're in outreach in the Kilmarnock, you're doing a full week of practice essentially, which is not really the case for a lot of students, and you're dealing one-to-one consultations. It's like having a medical student and then they go become a GP like automatically. It's a bit much. So it's a very different degree program, but that's what we're designed to do. So it's fine. So yeah, I suppose it's just hard work to overcome a lot of the challenges to get there. Did you do any extracurricular activities in and out of school? In school, I did all the usual stuff like I was head boy, so that helped. I did as a prefect. I went to Africa with my school to like a humanitarian project. It was really fun. I did what else I do? I did like Caritas. I did all this sort of normal stuff. I just kind of did everything, and that's you can do all that in second year. You can manage uni, so it's about being balanced and having time and organising yourself well. But yeah, I wouldn't turn down any opportunities. I would just take everything whilst you can get it, as long as it's not going to stress you out or make you suffer academically. Just do what you can, do what you enjoy, because you don't enjoy it, you won't do it. So if you only do one thing you really enjoy, just do that and love it. And if you don't like anything, then do a couple of things just to get the things for your personal statement and your CV. I didn't really work throughout school. I didn't really like jobs out with. I worked for a little bit when I was in first year uni. And then because the timetable was quite erratic, I couldn't really work that long at the place I was working. So I eventually found other jobs, so I did reach. That was good. I also played the viola, so I was in a lot of orchestras, did a lot of like sessional gigs and music, that kind of stuff, and that was good because it was always as and when, and that was always quite fun to do and enjoyable. So I did a lot because I enjoyed it. So things like that, you'll find out things you like to do. And working at uni is difficult with dentistry. You can do it, but you may have to sort of sacrifice your evenings and weekends to do it. It just depends how you want to fund yourself. So I got student loans and just kind of had it over comfortable for a few years at uni, but you could take less and work to compensate for your expenditures. But yeah, I was also at home for uni, so I didn't have a lot of outgoings for like rent and things like that. So it's different if you have a flat or you live in halls. So it's totally up to you. The extracurriculars are good if you can fit them in. So any specific tips to really enhance your personal statements? Good opening, good ending. So you need a punchy opening and a good closing line. I think I talked about why I went to a dentist in a very succinct way. I think I said something like the current population sort of perception of dentistry is it's all about veneers and whitening, but I see it as a lot more about oral healthcare and the impact it has on general health. Something like that, really, like just like state your intentions, like what is the reason you're applying for this course. And at the end, I think I closed it with something like, I appreciate that dentistry is an ever-evolving profession. You need to be continually learning and evolving your skills, and that's something that I want to do forever. I did something like that. It was a bit daft, but it did work because it felt quite succinct to the bottom and top, and that means your video's got a good thing to skim. And if all the way to the top, the bottom, and a bit in the middle, you've kind of got good bits everywhere. Linking your so all your extracurricular activities, all your skills. So like I'm a good listener, I'm organized, I've good time management. It's all fine and well, but unless you can link it to evidence, then it's useless. So if you want to say I've got good time management, I'm committed to this, I'm organized, whatever, and you say I can show all this because I am I'm a prefect or I run a club, or you have to give them evidence. They won't just take your word for it. So being very specific about what you do and how that then shows that you meet the qualities they want to see for their candidates. That's how I'd say you would stand out the best, and not waffling. Just make it very succinct. It might read like a robot, but you don't want airy fairy, nonsense. You want like, this is why you should accept me, because I can do all this and I will be successful and I won't cause you any bother and I'll be fine. That's generally what they want. And think about it, all you guys are all high achieving, top level people at your school. Probably you all probably get 5 A's at your hires. You're probably all be able to apply for dentistry. So you're all now at an even keel. So you need to be able to stand out a little bit. So you're all going to have 5 A's. You're all going to probably do all the same kind of things. So what about you makes you stand out, do you think, compared to your peers? And just think about it like, out of all my friends, what did I do differently? And then talk about that. And also try to spin things, like if you do like, see like cycling, for example. There's not much in cycling, it's a solitary sport, but it shows that you've got good like hand-eye coordination. Just kind of like just expand that a wee bit, and like that, because it means you're kind of being a bit, innovative with what you're trying to say and make it a bit more interesting there. Would the uni ask you to see your achievement certificates and stuff? Probably not. So if you said you have a Caritas award, or you've done first aid, or you've done that kind of stuff, they won't want to see any evidence of that. They'll just take that as word for it. But make sure you actually have done that, because at Dundee, as an interview, and I didn't lie, but I'd said that I helped out with the soup kitchen. So at my school, we called it a soup kitchen, which was like a homeless shelter thing where you go and give people who are homeless like soup and sandwiches and have a chat with them, that kind of stuff. So in my head, it's called soup kitchen. That's what I call it. But the person interviewing me said, "Oh, so tell me about your time you work at the homeless shelter." And I was like, "I haven't worked at a homeless shelter." And they were like, "What?" I was like, "I haven't worked at a homeless shelter. I think that's the wrong personal statement." And they were like, "No, that's yours." And they handed me my personal statement, highlighted, and went like that bit there. And I was like, that, yeah, and looked like I was lying, but I managed to kind of like talk my way through it, and I think it was fine. So yeah, just make sure you're telling the truth, and you can like talk about it quite readily. But things like your SQA results, all that sort of stuff, your achievements academically, that will have to be put into UCAS. So you'll have to show that, but that will be all be put in. That will be cross-checked with what they've got you on record as having. So no, I would say just keep a good eye on what you've said and make sure it's all accurate, and you can talk about it freely.
Quite often the school, because when the teacher does their reference, assuming they do a good job, they can quite often pick up on the same sorts of things and kind of really reinforce that as well. So
yeah, absolutely. Yeah, I would literally, my heart dropped. I was like, "What do you mean homeless shelter?" I was like, "I don't think I've ever been there before." And she looked at me and was like, "What?" And I was like, "No," but I could see it. I was like, "That is my statement." I had no idea what you're talking about, but it's all nerves. You're not really focused on that. And again, you don't know with MMIs as well, the interviews, what's coming up next. You don't know what the station is. So you just sit down and have to just deal with it as it comes up. Dundee's was a lot longer than Glasgow's. So Glasgow had like 8 stations in theirs, and Dundee had 20. So it was quite a difference. So it was a long interview process. But again, because it's constantly changing, it goes really quickly because you don't really have time to think about it. You're just kind of firing in, and it's all actors and sort of role play scenarios, which is quite interesting too, and doesn't really feel like an interview. You're just kind of trying to get a resolution.
All right, I think we might be towards the end. Yeah, just sorry, I was dealing with something else there, but obviously Tricia was saying yesterday that this year's interviews, because it's that 50% intake thing, they're going to be online as well. But the things that Ryan's saying there about the MMI and different interview formats might become relevant if you happen to be applying again next year. So definitely keep that in mind. And there are loads of, or at least there were anyway, I think there still are, different resources and stuff on the website about, the MMI and that kind of thing. Oh, there's another question.
Last question there. How do you prepare for interviews? Again, it's like you can't really prepare for them. MMIs are testing your core sort of values and your way you naturally react to something. So you could be in an interview where someone's an actor pretend to be your friend and they're drunk and they're asking you, "Oh, just drive home," and they've got keys in their hand and they're like, "Oh, just drive home, it's fine." And your objective there is to be honest with them and be empathetic, because they want to go home, but and be understanding, and then do the right thing ethically by telling them to get a taxi. And they also want to argue back with you, and you have to remain calm and professional and just tell them, "Look, we're going to get a taxi home. You can't drive home because you're a bit too drunk." And then if they get angry back, it's a bit dealing with that. So they're testing lots of abilities they want them to see if you can deal with. The one I had just very quickly was at Snapchat, and it was way back in 2015 when Snapchat was just like a new thing kind of. And basically my friend had just come back from holiday, my actor friend, and I was picking up from the airport, but on the wee card thing it says that her boyfriend's asked you to go pick her up because he can't make it, but the night before you saw a Snapchat of him kissing another girl, and it's a big, "Oh, like what's going on?" So you go in there and then she's like, "Why are you here?" And you have to be like, "Oh, so and so can't come and get you because he's busy." She's like, "No, he's not. And she starts crying, and you have to be like, "It's okay. Like, we don't know what's wrong." And like, that's the full thing. That's the whole thing. I mean, that's a very brief explanation of what the thing is, but it's about being empathetic and being honest. You know what I mean? These things are qualities they want to see in dentists and dental students. And you don't think about it at the time, you think, "What was that about? Why am I having to do this?" But it makes it kind of fun. It probably de-stresses you a little bit because you're not thinking about what they want to hear, my personal statement, that kind of stuff. But like panel interviews, or interviews with like 2 people over a desk, I would just revise general questions like, you know, why dentistry, not medicine? Why do you think you're a good dentist? Why this university? Especially if it's not in your home city. Because I got asked at Manchester, I was like, no, is that not a clue? And I've been to Manchester before, which was like a good
Oasis.
option. I love Oasis. Lovely city, metropolitan. So don't do that. Definitely do your research, because Manchester were like, right, okay, that's they're like, no, they're not impressed. They don't know a thing about the university. So do a bit of background. Also, don't go down the same day. I went in the same morning. It was like 8 in the morning. I had to leave at like 4 o'clock in the morning. I got there, I looked like I've been dragged through a bush. So don't do that. Go a day early if you're going somewhere else. Just take my advice.
And also, sorry, Ryan, just to reiterate a message that's been put forward over the course of the week. Definitely also in preparation for interviews, and obviously your personal statement as well, have a look at the person specification that Tricia mentioned yesterday, and also like things like the GDC person specification, for want of a better phrase, because they show you the sorts of things and the sorts of behaviours and characteristics that you're going to be assessed on as well.
Yeah, just answer the last question there. I can't remember what I said to the guy. I think I did tell her that I have a boyfriend without someone, but I said it could be his best friend or his cousin, who knows. So I don't know. I don't know what I said. It wasn't quick-witted, it was a bit clumsy. So I don't know the answer. I don't know the right way to deal with that. I think it was more about being honest with the person and being like comforting. That was it. So I wouldn't worry about that. If it comes up, just deal with it as it comes. There's no right way to answer that. So oh dear.
Okay, well, I think that's perfectly timed then. So no, just thank you, Ryan. That was really informative, really good. That was the first I'd heard about, like, really in detail about the VT or so. That's really good.
Yeah, it's good to know.
Aye. And thanks everybody for coming. I also just want to, Taylor's. Oh, right, aye. Sorry, I just want to say thanks, obviously, to the 2 tutors, Eileen and Shona, and also to the undergrad helpers that have been helping out through the week. They've been really great. I hope it's kind of added to your experience of the week. I'm sure it has. But yeah, thanks for attending the full week, and I hope you got lots from it. And as I say, we'll post this video online on Moodle later on. But thank you.
No worries. Right, see you after.
Thanks, Ryan. Sorry, see you later.
No worries.
Cheers.
Bye.